Welcome, I am Jabertha Atkinson. Today we invite you to join us on a journey of awareness and empowerment, a journey where the colors of pink symbolize more than a shade, they symbolize a movement. We bring you a story that highlights strength, unity, and the importance of awareness. This is a journey of breast cancer where survivors transform adversity into powerful advocacy. Join us as we shine a spotlight on courage, spread crucial awareness, and inspire change. We're now joined by Dr. Jason Copeland, breast surgeon and breast surgical oncologist. Thanks for joining us today, Dr. Copeland.
Thank you for having me, Jabertha.
October is Breast Cancer Awareness Month, but what truly is breast cancer?
So breast cancer is a disease of the breast where the cells in the mammary component of the breast, they have essentially developed the ability to grow in an unregulated fashion, and they can invade nearby structures or they can spread to distant organs. For example, the cells on the breast may spread to the brain, they may spread to the liver, they may spread to the bone. And essentially that's what breast cancer is.
What are some common risk factors associated with breast cancer?
Important thing to understand is that the majority of women who develop breast cancer have no risk factors that we can point to, maybe about 80% or so. It's extremely important. You do not need to have a risk factor to develop breast cancer. But there are some well-established risk factors that we're aware of, and such as family history. Patients with first-degree relatives with breast cancer, meaning parents, siblings, or offsprings, actually have an increased risk of developing breast cancer. Patients with certain genetic mutations, such as the common ones are BRCA1, BRCA2, these patients have an extremely high risk of developing breast cancer. And let me talk a little bit about the risk. Now, the risk for the average Jamaican woman developing breast cancer is approximately 7% lifetime, or 1 in 15. So if there's a strong family history of breast cancer, such as a first-degree relative, it actually doubles that risk. So that 7% risk now becomes 14%. I'd mentioned the genetic mutations. The BRCA mutations give you a 70% lifetime risk of developing breast cancer. So it moves from 7% to 70%. There are other risk factors that you are aware of. Many of them are hormonal because breast cancer is mostly a hormonal-based disease. We find that women who have never had children, we call those nulliparous, or women who have had less than 3 children are at an increased risk of developing breast cancer. Women as well who have had their menarche early, that is the onset of normal menstruation, under the age of 11, actually have an increased risk of developing breast cancer. So too women who attain the menopause after the age of 55. We've also seen an increased risk of breast cancer in women who are on combined oral contraceptive pills for a long time, usually more than 10 years, and also those women who use hormone replacement therapy for perimenopausal symptoms. So those are some of the hormonal-based risk factors. Importantly, there are some lifestyle risk factors that I should mention. For example, obesity in adulthood. What we have found is that women who gain weight in adulthood and become obese have about an 11 to 15% increased risk of developing breast cancer. Alcohol abuse has also been associated with increased risk of developing breast cancer, and this increases the risk by about 20% for women who have more than, say, 2 to 3 drinks per day. So those are some of the more well-established risk factors for developing breast cancer. But as I mentioned before, the majority of women who develop breast cancer have no risk that we can really identify.
What are some symptoms of breast cancer?
Typically, in early breast cancer, there are no symptoms. And that is why breast cancer screening is so important. Very often, you may have a cancer in the breast for 12 to 18 months before symptoms develop. Unfortunately, in Jamaica, over 90% of our women, when they do present with breast cancer, they have a lump in the breast. But there are other symptoms. Any persistent swelling, asymmetry, redness of the breast, scaling of the nipple or the areola area, or any abnormal nipple discharge may Any of these things may indicate that there's a breast cancer there.
How is breast cancer detected?
Ideally, we would want to be detecting breast cancer through screening. Typically, we use mammography and ultrasound. So in mammography, what we use is low-dose radiation to image the breast, and we may be able to pick up cancers long before it forms a lump. In societies that have widespread population-based screening programs, what we have realized is that they have been able to decrease breast cancer mortality rates or death rates by about 20 to 25%. Now, obviously, this is combined not just with early detection, but comprehensive breast cancer treatment. But we find that the screening component of it is extremely, extremely important.
Can you explain the importance of early detection?
So, the screening and early detection as a combination, we advise women to check their breasts, be familiar with the look of your breast, the shape of your breast, and any persistent abnormality should be reported to your physician. Reason for this: patients who present with early breast cancer, this is stage 1 and stage 2, they have better overall outcome. We have better options for treatment. Many of these women may not need a mastectomy. We can preserve the breast in over 50% of women who present with early breast cancer. The use of things like radiation therapy may not be necessary in some of these women. The morbidity of treatment is less. And of course, the long-term overall survival of these patients is much better. So the earlier you present with breast cancer is the much better the overall outcome and the more treatment options we can offer you. What I've found through clinical practice is that patients who have that support, that emotional support, that economic support, do a lot better. When these patients come to the office, very often we have a counseling session and we have a teaching session about breast cancer. The patient who has had the diagnosis may not recall, and very often does not recall, all of the information, even though we may give them reading material. But those patients who come with that support, they tend to do better. They're much more likely to follow up with their appointments and to complete the prescribed treatment. So it is extremely important, and I cannot overemphasize it. Breast cancer is the most common cancer in women worldwide and also in Jamaica. It accounts for more than 1/3 of all cancers diagnosed in Jamaican women. The projections, however, is that the incidence, the number of new cases of breast cancer will increase by about 40% over the next 20 years, and this is based on the WHO projections. Even more important than that is what we call the mortality rate, the death rate, and that is projected to increase by about 50% over the next 20 years. We have, unfortunately, high breast cancer mortality rates, not just in Jamaica, but in the Caribbean basin. And we need to be mindful of that and to strengthen our healthcare systems, our health promotion systems, to tackle what is going to be a significant increase, not just in the incidence of breast cancer, but also in the breast cancer mortality rate. When it comes on to breast cancer screening, traditionally we have used what we call a 2-dimensional mammography, and now in Jamaica we have access to 3D mammograms. The 3D mammograms tend to be better than the 2D mammograms, especially for young women who have dense breasts. It's more sensitive, it's more accurate. We also have breast MRI that we can use in high-risk women for breast cancer screening as well. In some patients with a diagnosis of breast cancer, we also use breast MRI to sort of plan the surgery, especially in women who are considering conservation of the breast. We call that breast conservation surgery. So those are some of the advancements in terms of imaging that we have available locally.
Let's highlight the warriors who have faced the daunting breast cancer battle and emerged victorious. Their stories of courage and resilience serve as beacons of hope.
Hi, my name is Sandra Samuels and I'm the president of Jamaica Reach to Recovery. Jamaica Reach to Recovery is a group of breast cancer survivors right here in Jamaica, and we're about 120 strong. We have been around for the last 46 years, and our primary focus is for providing support for the newly diagnosed, as well as offering financial assistance. With my journey, I was diagnosed at the age of 35. That was 23 years ago. And I was diagnosed with stage 2 breast cancer. I did a partial radical mastectomy, which is the removal of my left breast. I found the lump myself because I had taken out a lump 9 years prior. And so I was continuously every month doing my self-breast examination. Without that, I would not have found the lump because the lump was not in my breast per se, it was in my chest wall. My lump was not also found by a mammogram, it was found by an ultrasound, and that was because I knew where the lump was and I had the ability to show the doctor because it was completely missed by the mammogram. After I did my mastectomy, it was followed by 4 treatments of chemotherapy as well as 16 treatments of radiation. Challenges, well, the first challenge I had was to accept the news. I was not in denial at all, but it was a shock because at 35, that's the last thing you're really looking for. My biggest challenge to me, I didn't really think about dying. Because I was in the peak of my dating life, the biggest challenge for me was, when do you tell your potential suitor that you only have one breast? That was the biggest challenge for me. But as time went on, you devised a strategic plan of action. And what I found worked best for me was, as soon as I met the person, I said, look, this is my situation. This is my new norm. This is what I'm dealing with. So do you want to deal with it or not? And so that was one of the main challenges in terms of being a young person diagnosed with breast cancer. One of the major challenge for most of us is the cost of doing treatment. I went public. I couldn't have afforded private. Well, I did chemotherapy privately, but radiotherapy I did at the Kingston Public Hospital, because going privately, it would have been like 1.5 million. And at the time, I was in a young business. I owned my own business, and I was only 5 years in, so to take out a big chunk of cash to survive was just not there. And so I found that is the main challenge for most persons who are not even in a good situation like I was, because I considered myself to have been in a fairly decent situation. You have persons out there who are making a choice between feeding their families and doing treatment. So that's why we started the run, to have a major fundraiser to raise funds to help persons. Unfortunately, we can only help individuals up to a maximum currently of $100,000 based on funds available. We'd like to spread the help, so we only help. So to some people, 100,000 sounds like a lot of money, but it really isn't when you're trying to fight cancer, period. Not just breast cancer, but cancer, because everything is expensive. Treatment is expensive, surgery is expensive, aftercare is expensive. Just everything is expensive where breast cancer is concerned. We help with needle biopsy, we help with mammograms, we help with if you need a prosthesis or a prosthesis bra, we help with any kind of scans, any kind of minor op, anything that will take you up to the $100,000 to do with breast cancer. We do not give the money to the individual themselves. We pay the person that you're dealing with, for obviously for transparency purposes. So if it's the doctor, we pay the doctor. If it's the pharmacy, we pay the pharmacist. Anything like, if you're going to do a scan, we pay the company that's doing the scan. And so because we are a charity, a registered charity organization, and really and truly we have to be transparent in all that we do. My advice to newly diagnosed individuals is just to know that getting the diagnosis is not a death sentence. The hope is that you caught it early. So for those who have not yet been diagnosed, I want to say to you, please do your self-breast examination, your digital examination, which is just basically feeling your breast, know your body. Feel your breast around in a circular motion. It's easiest done in the bathroom when you're wet and soapy, so your hand glide around. Squeeze the nipple to see if there is any bloody fluid coming from your breast or any unusual looking type of fluid coming from your breast. Feel underneath your armpit. Nobody told me about feeling under my armpit, and under my armpit I had nodes that were involved. So at stage 2, that means there was some spread. I had spread to underneath my armpit. They did a nodal clearance, and out of the 14 nodes that were removed, 4 were positive. So you need to check underneath your armpit. You check your neck area, you check behind your ears, in between your breast, under your breast, in your chest wall, because those areas are not picked up in a mammogram. That's why I usually recommend that you do an ultrasound, follow up with an ultrasound. But just know that a diagnosis is not a death sentence. The thing you need to do is quickly move to do your treatment, to have the surgery done or whatever the doctor says, but don't just take what the doctor says. If you want a second opinion, the key is to be comfortable with your decision when you make it. So I did a lot of reading, my friends did a lot of reading, and so when I made a decision, I was comfortable with my decision. So I just recommend the same thing to you. Make sure that the decision that you make, you can live with it. Because I know many persons decide not to do treatment. It's not the best advice from anybody not to do treatment, or some people choose to go the naturopathic way. That is also a choice. But make sure that whatever choice you make, you can live with the decision that you made. Your support group is absolutely important. Many persons really forget that the caregiver, who usually is the closest person to you, it's as if they are also going through the cancer. The caregivers are very important. You must always remember them. Remember to check in on them as friends. I have a nice village, a very positive village, and they helped me through going through breast cancer. But most importantly, make contact with Jamaica Reach to Recovery. It is different, and I tell you why. When your friends or people out there tell you, oh, you're gonna be okay, just hold it, keep strong and do what you have to do and you'll make it, versus someone like me coming to you, having been through it 23 years, me telling you what to expect, that's the gospel. You can't beat that. When someone comes to you who has been there, done that, telling you that you can make it, it makes a completely different, it gives you a completely different mindset. When I was going through just hearing the news and someone came to me from Reach to Recovery, and she was, I think at the time, she was a 20-year survivor. That just made me know if she can do it, so can I. And I'm saying that to you. If I could do it, so can you. But you have to be proactive. You have to give yourself a fighting chance. You have to be positive. Your mental state is like 80% of your survival. I know people, or I've counseled people who are stage 1 and still met their demise. You really shouldn't, with that stage 1. But you see, negativity, you're being, you're not wanting to do treatment. Because finding it at stage 1 is a blessing. Stage 1 and stage 0 is a blessing. But you have to move swiftly because it can move from stage 1 to stage 3 in no time, depending on your situation. Everybody's situation is different.
Life after breast cancer is a journey of renewal, strength, and embracing new beginnings. Sandra tells us how she has redefined her life.
So let me tell you what my perspective was before breast cancer. So as I told you, I run my own business. So my life at the time was work. Don't leave the office. Work until 11, 12 o'clock at night. Don't take no vacation. Just trying to make the buck. After breast cancer, or being diagnosed with breast cancer, my perspective changed on life because all that I was running down didn't seem to matter anymore. And I looked at life a completely different way. I appreciated every moment. I started to appreciate every moment. I now take vacations. I spend time with friends, family. I make sure that every second counts. So I would say breast cancer made me so aware of how precious life is, and I live every moment in gratitude, complete gratitude.
We're now joined by Katie Levine McCoy, breast cancer survivor, advocate, and author. Thanks for joining us, Katie.
Thanks for having me.
Can you briefly explain to us your breast cancer journey from diagnosis to treatment to recovery?
Right, so, well, it's a long story, but I'll just jump right into it. So it was in 2020. I was 30 years old and I was just, I was taking a bath and I felt a lump. So, immediately I went to my husband and I said that there is a lump. And he said that, maybe it's nothing, let's just watch and see. Then in I think it was about April, I kept on doing my own self-examination after feeling the lump. So I felt the lump and it was still there and it wasn't moving, but it was getting bigger. So I said, no man, I'm not liking how this is feeling. And I said, you know what, I'm going to go to the doctor after my 31st birthday because I don't want to hear any bad news. But at the same time, I wasn't aware of breast cancer because I was only 30 at the time. And you probably heard 1 or 2 things about breast cancer, but you're not aware of like what to expect and the treatments and stuff. You don't know nothing much. Feel a lump, oh, it's breast cancer. So I said, all right. I watched it. I waited, and my birthday was the May 3rd. So after my birthday, I like maybe a week later, I went to the doctor, and when I went to the doctor, she said to me, I made the appointment, and when I made the appointment, I wasn't sure if I was going to go and see the doctor. I was like, if something comes up, then I'm not going to go. But of course, nothing came up. So I went to the doctor and she examined my breast and she said that there is a lump, but you're only 31. You just turned 31. And, these things happen when you're in your early 30s. They're like premenstrual syndrome, probably dense breast or something that they're going to aspirate. So I said to her, there's a strong history of cancer in my family. Well, not breast cancer, but cancer in my family. And she said, okay, let me just send you to do a mammogram and ultrasound. And I made the appointment. So that was the Wednesday, and by the Friday, I was getting the mammogram and ultrasound done. When I went in the mammogram, when I went to do the mammogram, the radiologist, she did the mammogram and she sent me back outside to wait. And she said, and I was looking at her reaction, but I didn't see anything of concern because, sometimes they'll have that reaction, what's that? So I said, oh, it seemed like everything is fine. They're going to aspirate the swelling, the whatever was there. And then I went in the ultrasound room, and then the doctor, she started making some sounds, like, So I was like, doc, what happened? What is it? Is it something that you're going to aspirate? And she said, to tell you the truth, this is breast cancer. And immediately I looked at her and I said, are you serious? And she said, yes, it's breast cancer, but whatever it is, you'll be fine. And I got dressed, and in the back of my head, I was wondering if she was joking. I'm literally waiting on her to tell me that, oh, it's a joke. But I said, a doctor wouldn't joke like that. That's some seriousness right there. But that's the denial that I was in. I was in denial. And she said that, it was breast cancer and I would need to do a biopsy. So I got the report from her the very same day, and I took it back to my doctor. So when I gave it to her, she started, she looked at it and she said, you know what this is? Do you know what this is? This is breast cancer, and you don't have no waiting time. And I'm like, man, I'm going to die. She said that there is no waiting time. So hearing cancer, no waiting time, I'm going to die. And so she said, we need to do a biopsy. So now the biopsy would confirm the diagnosis. And she said she wants a surgical biopsy, not a needle core biopsy. So she started making calls, and then she found one surgeon who was willing to do it. He wanted to do it the same day, but my husband was saying, no, that's too soon, let's wait. And I said, no, I want to get it done. But then we said, okay, let's go into the weekend, and then I'll get it done on the Monday. So I went and I saw the surgeon the very same day. So everything started moving fast immediately. And I remember, so that was a Friday. I remember the Saturday, my daughter was only 4 at the time, and she was, she had a brand new tree house, and she was playing in her tree house, and I said to her, I said, Savvy, mommy's sick. And she said, what happened? And I said, mommy is being diagnosed with cancer. And she said to me, mommy, are you going to die? And I said to her, mommy will not die, mommy will be okay. And the reason why she asked, because she usually asks about my dad, and she knows that he passed from cancer. So hearing mommy has cancer, then she's thinking that mommy is going to die. But I had to reassure her that mommy will not die. And then she started playing the song for me, the fight song. This is my fight song. And she started playing that, and she said, mommy, this is our song. And she was only 4 at the time. And then I started crying, a little teardrop, and I said, man, this is reality. This is when it hits that you have to fight for her, because she understood everything that was happening. And so she had to, stay with her godmother for a while because I wouldn't be able to use my arm. So, she stayed with her godmother for maybe a week or so, but I went in and I did the surgical biopsy, and I waited about 3 weeks for the results. But during that 3 weeks, I was eating and drinking. I was, when I say drinking, not alcohol, but I was, the regular soda and sweet stuff and chocolate, and I was eating cakes and fries and chicken, and I wish I was aware that, even though cancer is a lifestyle, it's not like I can change my diet overnight and I start seeing big changes, but at least, hey, I can cut off certain things in the interim until we know what we're dealing with. And so I was having all of that, my body was craving, and with no one to say, listen, we don't know what we're dealing with, so if you could just, have a balanced diet. No, we're dealing with this. And so I was, eating, and I was a little concerned because, waiting on the results, I would say it's one of the most dreadful parts of it, because you need to know now, you're waiting to know, if this is cancer and where do we go next? And I waited 3 weeks for the results. I was on my way to get some lunch, and I heard a message came in on my phone, and it was a message from the doctor that, I have the results and they're not good. I need to see you. I started crying, and my husband said, you know, what happened? And I explained to him, and he said, you know, don't cry. Let's see what can be done. So for that moment, I said, oh, you know, I started wiping my tears, and I said, something can be done, you know. And that's when I realized that it's not a death sentence, you know. There are treatments, you know, options. A lot of options are there. And so I went to my doctor, and he said that it was stage 2 estrogen positive breast cancer.
You mentioned your husband and your daughter's godmother. How important is it for breast cancer survivors, persons who are going through the journey, to have good family and friend support?
Hey, listen, you know, as you say that, I'm shivering because I could not have done it without my support system, because at that moment, and what I did was I went on into multiple surgeries. I did like a bilateral oophorectomy, nipple-sparing mastectomy, and reconstructive surgeries. I did, you know, multiple surgeries. So imagine, plus chemotherapy and the radiation and double portacat surgery. So everything was happening all at once. I didn't, like, the surgeries were done all at once. So imagine not having my daughter's godmother there as a support to look after my daughter, you know, when I was in the hospital, and to recover from all of that, and then chemotherapy that comes with the sickness as well and the side effects, then radiotherapy, which is every day for 5 weeks. So support system from my husband, my daughter's godmother, my husband's daughter, Amber, who is a doctor as well, so she could relate to me and tell me, all right, this is happening, that this is what the doctors mean, you know. And so for me, my support system, and then my cousin who took care of me, my little brother who made me laugh. So it's everybody, it's the family together, like all of us, everybody was on the journey together. So I had a mountain of support, with each bringing different gifts of strength. And every day I'm still grateful that my support system was awesome. It was overwhelming. I felt so blessed, and most days I would open my doors and I said, thank you, God, thank you that I have the support, and, you know, the support of just everyone. And it is very important to support those fighting, even if the person is a stranger, because I reach out to a lot of women and I try to give them support, because I know how important it is, you know, with the fight. You need that support. You can't do it alone. You can't.
What would you say is your greatest challenge, or some of the challenges you faced during your breast cancer journey?
Oh, some of the greatest challenge is coping with the side effects, because you hear, you know, we listen, like we do our researches, that once you hear that you have to do chemotherapy, then you start, you know, to research chemotherapy, and you'll see that chemotherapy you can get, you know, so many things can happen, side effects like heart attack. So for me, the mental part of it is researching and knowing what you're dealing with, and that, you know, this can happen. And while getting the chemo, I am afraid. I'm afraid of dying. Like even now, I am still coping with the mental part of it. So the mental part is a big challenge, because you're also fighting. You're fighting yourself. You're fighting yourself mentally, and, you know, just thinking about dying. You know, am I going to die from the treatments? You know, so for me, the mental part and the treatments and the side effects, you know, how do I recover? It's recovery. Do I get back my life? You know, is things, you know, are things going to be the same as it was before? And, you know, is my husband going to love me? So it's just the mental part of it that was a bit challenging for me.
After breast cancer, how has your perspective on life changed?
Lord, I appreciate life so much, and I can tell you this pen is pink, but if you say that this pen is blue, then it is blue. I won't argue with you. I am not going to argue. It's a blue pen. And I learned to appreciate everyone around me, my family, my friends. I appreciate every day that I get. Every day I live, I breathe positivity, you know. I mean, we're all humans, and sometimes you'll get a little one-off, you know, negative feeling, but don't let it overpower you. Be 99%, if you can be 100, positive and have gratitude. You know, I I just get up every day and I'm just so grateful. And if tomorrow I feel like I want to travel, and I can afford it, I am going to take that trip, because life is short. And I tell people, you die once, but you live daily. Don't wait until you're sick to appreciate you and your family around you. Appreciate what you have now, because now is what matters.
And what advice would you give to someone who has been recently diagnosed with breast cancer, going through their breast cancer journey, or even just recovered?
So, what I would say, listen, that's life. Sometimes we go through we're like climbing the ladder and we fall down, but we have to get up and climb again. You cannot give up, because if I gave up, my daughter just got Student of the Year. She's now 7, she was 4 at the time. I never thought that, in my head, with all the challenges, that I would be able to, I'm like, God, if I see 2 more, if I get 2 more years, I'm grateful. 3 more years, I'm grateful. My daughter is 7 now, and I'm here for her. So sometimes that's life. You go on a dark road, but you'll see the lights at the end of the day. You'll see the lights at the end of the road. Just keep pushing and then never give up. It's not going to last forever. Just have gratitude and just remain positive, because as I say, it will not last forever. I lost my hair, my lashes, my brows. Look at me now. You can never, you can't tell that I've been through a lot, and it will get better. It can only get better. Just remain positive and just keep pushing through, because this too shall pass.
What resources or organizations were integral in your treatment and recovery from breast cancer?
So first, the first organization that I benefited from was the Jamaica Reach to Recovery. I remember because when I got my diagnosis, and you hear that about the millions that you have to pay for surgeries and all this, and everything is at maybe $5 million, and then you have to do chemotherapy and radiation. And I remember when someone told me about the Jamaica Reach to Recovery, and I got the contact number for the president, and when I called her, and I didn't even ask her for anything, and she said, I am going to pay for one of your chemotherapy treatments. And she paid, and through the Jamaica Reach to Recovery, I benefited from them, and now I'm a part of the group and the PR person, So the Jamaica Reach to Recovery is one of my first major support, from an organization. And I recently benefited from the Chase Fund. So you just have to do your research, and there are support groups, there are institutions that are in place to assist, but you just have to do your research and get yourself involved in groups so that you can get information, just like I did from the Jamaica Reach to Recovery, because there are lots of fighting sisters and survivors there, and we share information to help each other.
So we spoke about your journey and your advocacy, but your advocacy continues because you're an author. Tell us about that.
That's right, yes. Yes, I wrote the book, Courage in Bloom. So, Courage in Blooms goes deep, because it takes you into my household, what's happened way beyond what I would tell you here now, and my relationship with my husband, how it affected us, my daughter, how it affected her. And I wrote the book because people, like, whenever I share my story, people are amazed with how I transitioned from being a breast cancer fighter to a survivor, and I'm so brave and I have so much courage to share my story. And so this is part of my advocacy, because it's not just sharing my story, but it's also helping women who are fighting. There are lots of information in terms of, questions to ask the doctor, or, like how you deal with your spouse, how do you continue to keep, a healthy relationship, because there is a life after cancer. There is life, and even during that period of dealing with it, there is life. You still have your child, you still have your husband or your boyfriend, you still have to pay your bills. So there are lots of information as well. So it's really a guide, dealing with breast cancer. And there are real pictures and and you know, as I mentioned, the text from my doctor that is in it as well. You'll see the scar from my mastectomy. You'll see the tube, the drainage. You'll see, you know, pictures, and even when I was celebrating, you know, when I finished chemo. So there are lots of information, and I encourage I wish I could, you know, donate them and give them away for free, but you know, everything comes with a cost to print, and so yes, so a lot of overhead. So but I'm hoping that one day I'll be able to give back, and I'm hoping to give at least 10 books, donate 10 books, you know, to the Jamaica Reach to Recovery, and they can choose, you know, 10 women who will benefit from the book. So yes, so Courage in Bloom is a great read for everyone to read, both men and women, because men they're on the journey with us as well. They're on the journey, and so it can help them to cope, because, you know, men would ask, you know, so how your husband dealt with it, and, you know, so all the explanation and everything is in the book, Courage in Bloom. A daughter's love, a mother's victory, conquering breast cancer together.
Mammograms are a cornerstone of breast cancer detection, but there are common misconceptions that need debunking. Our guests demystify the facts and myths surrounding this crucial screening tool.
You know, there is a misconception out there why persons are afraid to do mammograms. Think about it this way. A little second of discomfort versus not being here at all. Think about that just for a minute. The mammograms, what is a mammogram first of all? A mammogram is an X-ray. The only difference with a basic X-ray is that a mammogram has 2 plates and it pushes your breast together, right? Top to bottom, side to side, and it squeezes it very to make it tight, but not to cause tremendous pain that I'm hearing about out there. That's a misconception. It is uncomfortable, but many things in life is uncomfortable. So what I want you to do is to choose life. There's nothing that is so uncomfortable than for you to seek the knowledge to find out whether there's a lump in your breast or not. Also follow up, as I said before, with an ultrasound. If you know that you are feeling a lump and the mammogram say it's not seeing it, ask your doctor to follow up with an ultrasound. Just please take care of yourself. Make yourself number one.
Some of the rumors, you know, you hear that it's catching. I remember when when I was diagnosed, my sister didn't want to come close to me. She asked me, you know, if I come close to you, am I going to get breast cancer? And I said, no, it doesn't work like that. So that's the one thing I'd like to mark, you know. And not even like getting breast cancer, but even with the mammogram, like people think that, oh, your breast is right here, and they just clamp the thing down. It's not like that. It's a gentle squeeze. So don't be afraid to get those mammograms done and do your self-check.
As we close this feature, we leave you with inspiring words from breast cancer warriors and the insights of Dr. Copeland. Their wisdom and experiences offer encouragement and knowledge as we continue our fight against breast cancer.
My advice would be to, one, get a support system in place. It's extremely important that you have your own support group. Find maybe a family member or a friend that you are able to confide in, somebody who can accompany you to your consultations. That's one big aspect of it. The other one is to avoid delays. Unfortunately, a lot of our women who are diagnosed with breast cancer or who suspect that they may have breast cancer very often will delay presentation to their physician. And that is one of the most significant aspects of increasing the breast cancer mortality rate in our country. About 40% of the women locally actually present with stage 3 breast cancer, and that is significant and often because of delays in presentation to their physicians.
The message that I would like to cement in many people's minds is the same thing I've been saying. Early detection saves lives. Make sure you take care of you. If you are faced with breast cancer, you got a diagnosis of breast cancer, just remember it is not a death sentence. There are many of us, many. We're only 120 strong at Reach to Recovery, but I know many who don't belong to our group who have been surviving, right? Yes, some do meet their demise, and that is unfortunate for whatever reason. Some people's cancers are resistant to the drugs. Some people come in late stage. Some people, it's just, I can't find a word to say, but that's life. Some people make it, some people don't. What are you going to do about your chances? That's what I want to know. Make sure you do your self-breast examinations and make sure if you find a lump, go out and get tested.
I try to tell them, don't give up. As I said before, you don't never give up, have gratitude, try and share your story. Not everyone likes to share their story, but the purpose of sharing my story is it's part of my coping mechanism, and it helps me as a person to advocate for other women, because we know what we're feeling and we don't want another woman or woman to be in the same position that we're in, because it's not a good feeling. It's a feeling of fear and death and anxiety. So share your story. It helps, and you feel good because we're saving lives. Just to get involved, find support groups like the Jamaica Reach to Recovery. And as we're seeing now that a lot of Jamaica and Jamaicans they're so involved now with breast cancer, the advocacy. Like I saw a building the other day in pink, everywhere you go, or you see people on the road, everybody's wearing pink, they're wearing a pin. We just want, everybody just need to do your self-checks, mammograms, and just spread the news with your sisters, your family, your friends, send out a message, hey, do your self-check, do your own self-check. Remember to get your mammogram done. Everybody, just a little post, everybody's on social media, just post this, hey queens, make sure you do your self-check, do your mammograms. So we can all play a big part, finding those organizations that support and join the fight as well, just what, everybody's doing right now.
As we conclude this chapter of breast cancer awareness, we hope today's journey has touched your heart and kindled the flame of compassion. Remember, breast cancer is not just a disease, it's a cause we can all champion. Every ribbon, every step, and every gesture counts in the fight for a world where breast cancer is no longer a threat. To everyone battling, to survivors who inspire, to caregivers who selflessly give, and to advocates who tirelessly work, you are the heart of our collective hope. Let's carry this hope forward, raising awareness and extending our hand to those who need it. Thank you for being a part of this journey, and let's continue to inspire others.